Welcome to the budget series by BCL India. I'm Sandeep and I'm joined here today by Dr. Geetha Manjunath. For those who do not know, Dr. Manjunath is the CEO and founder of Niramai Health Analytics. Niramai has developed a method for breast cancer screening using artificial intelligence. She also holds a PhD in computer science from the Indian Institute of Science and a degree in executive management from the Kellogg School of Management. She is also the inventor of 15 US patents, with even more down the line, and has co-authored the book on cloud technology called Moving to the Cloud. Dr. Manjunath, thank you so much for taking time out of your busy schedule to join us here today. We really appreciate it and are excited to be able to talk to you about the state of healthcare in our country. So,
thank you very much, Sandeep and
yes.
Pawan, for this opportunity to talk to you.
So to begin, the government has reacted to the pandemic and has increased its healthcare expenditure in the budget last week by 137%, which includes 35,000 crores that have also been set aside for the COVID vaccine. What is your reaction to this, and how would you rate the manner in which governments around the world have handled the pandemic so far? Do you think there's a victory over the pandemic around the corner?
Yeah, a good question. I think government focusing its budget around healthcare is an excellent and a welcome move in my perspective. Um, 137% is a starting point. Clearly, so far India had seen very low budget accommodated towards healthcare. And the fact that there is a focus towards increasing it is good news. While, of course, there's huge scope for further increase and also need for further increase in this particular domain, this is a great starting point. That's how I view this increase. Uh, Particularly, I was very pleased by the fact that there are certain incentives placed by the budget towards preventive healthcare, with certain focus towards investments in welcoming investments in insurance related, preventive insurance, preventive checks, wellness, and so on, because that's a big deal. I mean, that's very, very important, because we all know prevention is better than cure. And I keep saying prevention is also easier than cure, especially when we talk about cancer and other places. And prevention is also less costly than cure. So with all of this, for a country of our scale, really we need to focus on prevention. And the fact that the budget does touch upon that is an excellent uh, excellent point in my view as well. Then in terms of handling pandemic itself, I think I am pretty optimistic, and also pleased with the way our government is handling this. It's not easy. It's not like a small job to vaccinate millions and billions of people that we have in India. Still, I understand, we've been able to look at some kind of indigenous developments here with the two vaccines around the corner, and also being used definitely for healthcare workers, and now around the corner for the public. I think we've taken the right steps as well. There's a lot of, misinformation, around the safety of this vaccine and all that. And I think it's not called for. We are on the right track, and fighting pandemic with vaccine is the best way to do, to create some kind of a immunity around the country. And yeah, I mean, I'm very pleased with the way this is turning out. Not sure about the victory, because nobody understands this pandemic uh, in the world in some sense, because we see some instances of second phase, third phase. We see instances of variants coming around and so on. Um, Time will tell, but I think at least the population can get prepared to go to sort of normalcy, probably mid this year, and provided no more spikes come in. Yeah.
Okay. So the second question has to do with accessibility to healthcare in our country. India falls behind many developed and even many developing countries on important metrics like number of hospital beds per 10,000 people and number of physicians per 10,000 people. How do you think we can improve accessibility to healthcare in India?
Absolutely, and this is a key problem which pains me a lot. The what I call as healthcare divide that exists between the urban population and the rural population are generally underprivileged even in urban area. We have most of the doctors concentrating in the urban areas, so that sort of is the accessibility angle to it. Of course, infrastructure is pretty expensive, and so that also looks for people who have good paying power, and so that they stay back in the urban area. Um, and also, of course, the ratio between the patient and the doctor, right? It's basically small in in India compared to any other developed countries. So with all this, definitely there is a huge scope and opportunity to make a difference here to enable, high quality healthcare, high quality, affordable healthcare for everyone, right? So in this regard, my personal bias has been in use of technology for this. One big thing that COVID again has made a difference is in enabling telemedicine, telehealth, and enabling a trust infrastructure around it. That is, people are comfortable calling a doctor, taking um, you know consultation over phone, over video, right? And that is something, though the technology existed, but that is something that became very, very prevalent due to COVID, right? Because people were forced to just get non-critical healthcare over phone or video. And this also meant that they started trusting the guidance given by doctors over phone. The doctors felt comfortable giving this guidance to the patient. So there's this human angle which also got refined over these last few months and a year almost now. And that's a big thing because now we can look at this as a way of bridging the accessibility gap to the rural or basically remote areas to places where the experts are. This also increases uh, the scale and scope of the experts, not just limited to the hospital, but being available to multiple hospitals, multiple PHCs, and so on. And thirdly, which is also very dear to me, is like in every PHC, we can now start thinking about having some kind of you know, um, health vital, what we call as point of care devices, and create some kind of a center of excellence, center point of telehealth, or something like that. So people need to go to their closest PHCs to get access to the best experts in the world. And that is possible through telehealth. And coupled with these point of care devices, which will have AI, for example, artificial intelligence led brief analysis at again, the edge, we call it, right, near the village itself, also reduces the volume, to unnecessary noise and volume to the central location, right? So there is some kind of a triaging that is done at the leaf level, and these things can come in. So short answer is basically, we are at a stage where health technology can be used to bridge this gap and enable high quality healthcare, making it affordable to everybody as well. And this is the right time. COVID has really helped us mature those technologies much more during the last year.
Okay, fair enough. The next question has to do with, there are many foreign institutions like the Bill and Melinda Gates Foundation here in India that are trying to make a difference in our health sector. How successful do you think these organizations are, and what sort of impact are they having? Do you think the government is doing a good job of supporting them?
Yeah, see, these non-profit organizations are doing a great job, be it Bill Melinda Gates Foundation or CDC or Even our own, non-profit organization, NGOs, local Indian ones, right? They're doing a great job in serving this community, underserved community, right? Where what we talked about earlier, the people who are not getting high quality healthcare due to accessibility or affordability issue. These organizations mostly are trying to address the affordable angle by providing some kind of sponsorships or discounting, in some sense, subsidy for these high quality healthcare. I think that's great. Of course, last year saw COVID picking up a lot of these funds, and so other diseases suffered actually. I mean, like, for example, we work in cancer care, and cancer is not going to wait just because COVID is there, right? Because the number of cancer deaths, in fact, increased in 2020 compared to the previous year, because people took less care of themselves. The preventive screening or early detection that is needed was not happening. Having said that, all these kinds of sponsorships is completely welcome. The only thing I would say is, yeah, and you mentioned about government partnership. I'm today. I don't. At least in my view, there's no partnership with an NGO and a government that's happening apart from a few, tax benefits and so on. But what could definitely happen is, in some way, if this external funding that's coming in from a sponsorship perspective can be used to strengthen the infrastructure instead of feeding every person. For example, we conduct a lot of breast cancer screening, and we may get sponsorship for conducting the screening. Having said that, if you use the same money to enhance the infrastructure in a PHC with the screening support, with the personnel being trained, right? It's like this, when a person is hungry, don't give him fish, you teach him fishing. That's a very well-known proverb. The same way, I think all of these organizations, if they look at it more like, how do we make these funds usable to create a sustainable infrastructure for delivering good healthcare in the long run, right? I think that will be good. I'm sure many of them are thinking in this way, but focusing on the infrastructure support would be a much more welcome thing. And here, of course, government can play a role. I am personally not aware of any specific program in government which will seek these funds and utilize it for the infrastructure. Probably that's an opportunity.
All right. Okay. And the final question has to do with your own work.
Sure.
You have developed a method that uses artificial intelligence to screen breast cancer. What role do you see AI and machine learning play in the health industry in India going forward? And what are the costs associated with this technology?
Yeah. So yes, we have tried to use artificial intelligence based devices and solutions for detecting early stage breast cancer. Breast cancer is really one of the largest causes of cancer deaths in women, with more than 90,000 women dying every year in India alone. And this definitely needs to be stopped, and it can be stopped because the other countries have seen more than 90% survival, whereas India and many such developing countries are seeing more than 50% mortality, that is deaths. So which is the bad part of it. And so there is an opportunity to save so many lives, and just all we need to do is to enable early detection. And so what we have done at Niramai is to use artificial intelligence and a new kind of sensing called thermal sensing to enable early detection of breast cancer, and do it in a way that it is much more affordable, much more accessible, as well as in a way that it can work for women of all age groups, and doing it in a very, very privacy aware manner and a radiation free manner. Now, AI definitely has a huge scope, but I briefly alluded to in my previous answer, to be the smartness associated with the point of care devices. It's not just for cancer, it could be, let's say, arrhythmia, that is basically heart issues, cardiac issues, or it could be BP issues, whatever, right? You could actually create some kind of an expert system or an AI based smart robot kind of a thing, at the point of care devices. Point of care devices basically measure these quantitatively measure different health vitals or any of these issues, abnormalities in the body in a quantitative fashion. And these numbers can be used by the smart AI modules to figure out who among these people in the villages need to be brought to the hospital now, right? This triaging, as we call it, figuring out, the emergency needs of the people at the right time, at the right place is very, very important, aspect of this, strengthened tertiary infrastructure. This also will ensure that the main place, right, strengthen primary infrastructure and reduce load on the tertiary infrastructure. So this will also ensure that the urban areas are not loaded by simple, not very emergency, not very critical kind of people, and so it's actually the best use of resources as well. So in that sense, I feel AI can play a huge role in enabling one, preventive care, so you could also predict something that's going to happen in future. Second, identifying these kind of prioritizing people who need urgent care, right? So the both of these is a huge opportunity. Now we see a lot of wearable devices, a lot of startups doing these point of care devices. All of that generate the data that is needed to enable such AI modules, AI models, everything for different diseases. And government is also supporting it. I guess we can do more by enabling proper regulatory framework to ensure that people don't make mistakes while doing these experiments, right? Obviously we should not be, it's a huge cost of a life that can affect it. So with proper regulatory framework in place, and good technology based solutions, I think it's a huge opportunity, and future of healthcare is going to be AI and digital, with most of the decisions made with automated robots like this. Of course, with health workers getting some additional skills because they're going to use this, and doing that, accessible way in all remote areas, and in an affordable way, and making our even rural healthcare very, very sturdy.
Okay, fair enough. So I think we've covered everything we wanted to talk about today. Once again, Dr. Manjunath, I'd like to thank you for your time. It was an absolute pleasure talking to you. Fascinating discussion, and I'm sure our listeners are going to enjoy it. Thank you again.
Thank you very much, Sandeep and Pawan. It was a pleasure talking to you about this. Thank you.
Thank you.